My name is Roy Kears, and I'm currently the Vice President of Recovery Services and Community Partnership for Samaritan Daytop Village, one of the largest providers of healthcare in the state of New York, with a host of services that cover outpatient, residential, methadone to abstinence, medication-assisted treatment, housing services for those who are affected by addiction and substance use disorders. And I've been doing this work for over 40 years now. I came into this business as a transition from being a client, a person with a history of addiction. For 15 years, from the age of 13 up to the age of 28, I was a heroin addicted criminal drug addict. I spent my days and nights on the streets of New York, victimizing New Yorkers, all for the purpose of gaining access to heroin to support what had become, at times, a 4 to 5 bag drug habit. Those were intense days. I've done some things that I regret terribly. I realize now that when one is in the grips of heroin addiction, they're not the controller or master of their destiny. They have to submit to the whims of the addiction. And if the addiction tells you to be disrespectful, you're disrespectful. If the addiction tells you to be a criminal, you're a criminal. If the addiction tells you to rob from your parents, you rob from your parents. If the addiction tells you you don't need food, water, sleep, or anything, just the pursuit of the addiction, that's what you do. And you live in the streets, you become homeless, and you do a lot of things that perhaps you shouldn't do. In fact, that you shouldn't do. Sometime in late 1979, without giving you all of my history, I found myself after years of addiction, after years of going in and out of prison and in and out of detox. I found myself in the bottom of a stairwell. And I looked up in that stairwell and a stream of urine was going over my head. And I woke up and I was afraid to move to avoid myself getting pissed on. And when I looked up at the stream of urine coming over me in the bottom of the stairwell, I realized, and I said to myself, Roy, you have reached your bottom. There's no lower you can go. You've been sleeping on park benches on Eastern Parkway in Brooklyn. You've degraded yourself in so many different ways. And here you are at the bottom of the pit. That realization was one of the realizations that prompted me to go into treatment. I would have to subject myself to a little more before I finally arrived at a program on the Lower East Side of Manhattan over 40 years ago and began my journey to recovery. I was a client in that program for many, many years. And then I transitioned into becoming a counselor from that program. So my entry into this profession was a transition from being a client to a counselor, to a supervisor, to a program manager, to a program director, to a divisional director. Along my journey, I improved the quality of my life by getting a GED while in treatment, also receiving a bachelor's degree, associate degree, and a master's degree during the course of my recovery process, ultimately becoming the director of the program that I had went to treatment in. From there, I got involved in community service and in advocacy for recovery through many associations, Therapeutic Communities of America, the Association for Substance Abuse Providers of New York State. I've served on the Governor's Advisory Council for substance abuse. I've also been chair or board members in a number of organizations, Faith Mission Crisis Center, Exponents, where I'm currently a board member. And finally, my travels led me to Samaritan Daytop Village, where I, for the first 10 years of my tenure here, served as the Vice President of Residential Services, and now I'm the Vice President of Recovery Services and Community Partnership. Now, I list all this not in any way to boast, not in any way to speak about the measure of the man, but rather of the measure of possibility that's available to someone when they undergo treatment. This is why I'm a strong advocate for treatment. Treatment changes lives. It enables one to rebuild from almost nothing to something. So I encourage all who is listening to this, who witnesses, not to think about Roy and my individual journey, but think about the possibilities that are available through treatment and recovery, which I'm here as an advocate for today. I want to tell the family members who are out there, if you have a child suffering from addiction, get them into treatment. If you have a school child thinking about experiencing, think about prevention, and checking with your school or in the local community about prevention services available. If your child has been talking about using drugs or you feel they're in danger of experimenting with drugs, if they're already involved in using substances, then try to get them into treatment. Call Oasis, call any of your local community healthcare organizations and find a treatment provider near you. Or you can call Samaritan Daytop Village, which is listed on our website and which has available information about outpatient services, residential services, and community services, and all sorts of housing services to help an addict begin their recovery process. I want to briefly talk about the positive aspects of recovery, but also the negative aspects of addiction. When one is engaged in addiction, they begin to become, they fall off the path of normalcy, I'll say. They're no longer interested in school, work, family relations, responsibility of any of those things because the addiction dominates their lifestyle and their every waking thought. The goal is to get people to break the cycle of addiction and get people into a treatment and recovery process. Not just treatment where the addiction is dealt with, but also in recovery where they're able to help sustain themselves in a process of maintaining their recovery. And that's extremely important. It's extremely important because we break this cycle not only by people stop using drugs, but by people not relapsing back into drug use. That is one of the dangers that many of the people who come into our system face. They'll stop using drugs, then they'll meet with some tragedy or are confronted with some type of adversity, and they fall back into drug use. We want to prevent that from happening. We want to break the cycle of addiction, When the pandemic hit New York, which we're facing right now, the COVID pandemic, one of the things that was evidenced early on was that we had to begin to stabilize the amount of infections and crush the infection by not only stabilizing the numbers, but to reduce the number. That's what we have to do with addiction. We have to stop the number of overdoses from going up, but reduce them to eventually there are no more people dying unnecessarily in the state of New York and around the country. Last year, over 93,000 people who died from overdoses. That is unacceptable. One life is unacceptable to overdose, and we need to prevent that in any way we can. And that's why I've reached, after over 40 years in this field, I've reached the conclusion, life over modalities. People will say, What modality would you represent, Roy? Prevention, treatment, recovery, harm reduction. What do you think works the best? Uh, the thing that works the best is anything that saves lives. That's what works the best from my point of view. After all of years, if a person could be prevented from ever using drugs, more power to that approach. If people who are using drugs can stop using drugs because of a treatment intervention, more power to treatment. If people who have established recovery could be maintaining recovery through a recovery pathway, more power to that. If people who are using drugs are having difficulty of stopping all at once and need harm reduction to help them begin to slowly stop hurting themselves, more power to that. In other words, more power to any mechanism to help people save their lives. And that's why I've reached the conclusion, life over modalities. We have to work together, all the different modalities, to help and support each other in saving the lives of the individual, the family, the community members, those who are out there sick and suffering and dying every day from the use of drugs. This can be stopped. It must be stopped. And we are the key to that by all of us working together to do that. It's important. I want to encourage the addict who's out there sick and suffering. There's help for you. Don't turn your back on help. I know it's hard to wrap your arms around the help that is available because your addiction is dictating what your every move. But stop and think. Remember the person you were before addiction set in. The loved child, the loved family member, the father struggling to take care of his family, the mother struggling to take care of their children. Remember the person you were, the devout church member, synagogue member, faith member, whatever it was that you used to motivate you in life, to help you be a decent person in life. Look to that and reclaim that through recovery. And recovery is your source to reclaiming who you are, the person that you can look in the mirror and say, I'm proud of that person. You don't have to sleep on park benches. You don't have to be homeless. You don't have to be destitute. There's help available. The Office of Alcoholism and Substance Abuse Services, which is now known as OASIS, and the Office of Addiction Services, or whatever the current name is, is an office set up and designed to help those struggling with substance use disorder. And it's important that the help that's available to you in the community that's funded by these services, that you take advantage of it. I'm concerned about you. I care about you. There are a lot of people care about you, and you need to take advantage of those resources that are available to you. Get help, it's available. The last thing I'd like to say to you before I conclude my remark, and I think it's extremely important. We can beat this thing. A lot of people think that it's hopeless. A lot of people think that addicts bring this upon themselves. That is all it takes is a lifestyle change. All they have to do is say no. It's not that easy. We've learned over the years that addiction is a disease, that it has mental health and physical implications. We've learned that it's not so easy to just stop using, that you need help and support. Support and help is available. And we need to work together to get that help out there to as many people as possible. No life that succumbs to an overdose is acceptable. No life, let me repeat that is needlessly lost to an overdose is acceptable, because overdose can be prevented. Overdose can be stopped, and we must work together to do that. I appreciate y'all allowing me time to enter into your lives for a few minutes, to talk to you about what I'm very passionate about and has been for over the last 40 years. I'm proud of my recovery. I'm proud that I no longer wake up with a need to stick a needle in my arm and to feel the rush of heroin through my vein. I'm proud that I have a master's degree. I'm proud to have a bachelor's degree, an associate degree. I'm proud that I walk in my community today as a respected member of the community. I'm proud of my faith-based services that I go into prisons in Long Island to bring a message of recovery and support to prisoners. I'm proud of any community service I could do to help another struggling addict. I'm proud of that because somebody reached out to me. Somebody helped me in my hour of need. And so I thank you for the opportunity to talk to you. Know that help is available. Know that you can change. You can be the person that you've always wanted to be, the person you were meant to be. Take that first step. Reach out, call somebody, get involved in a self-help meeting, start the process to your recovery. Go to a local recovery center. Do whatever you need to do to help you. Thank you.